In a shocking turn of events, millions of lives across Africa hang in the balance as critical HIV treatment programs face imminent collapse. Why? A freeze on U.S. foreign aid under the USAID program, leaving countries like Nigeria, Kenya, and Lesotho scrambling to secure life-saving antiretroviral drugs. According to WHO Director General Tedros Adhanom Ghebreyesus, the disruptions to HIV programs could undo 20 years of progress. To understand the gravity of this crisis, we need to revisit the origins of the HIV epidemic in Africa. The virus, first identified in the 1980s, spread rapidly across the continent, fueled by socioeconomic disparities and inadequate healthcare infrastructure. By the 1990s, Sub-Saharan Africa became the epicenter of the global HIV crisis, with millions infected and dying annually. International aid programs like the U.S. President's Emergency Plan for AIDS Relief, launched in 2003, brought hope, providing antiretroviral therapy to millions and saving over 26 million lives globally. Fast forward to today, and that hope is fading. The Trump administration's decision to pause USAID funding has left 8 countries on the brink of running out of HIV medications. The decision to pause funding has substantially disrupted the supply of life-saving medications, putting millions of lives at risk. The WHO stated on Monday that the affected countries, that is Haiti, Kenya, Lesotho, South Sudan, Burkina Faso, Mali, Nigeria, and Ukraine, could soon face critical shortages of HIV drugs. The organization estimates that this could lead to over 10 million new HIV cases and 3 million deaths, a catastrophic reversal of progress. In Nigeria alone, nearly 2 million people rely on aid-funded HIV medication, while Kenya ranks 7th globally in HIV prevalence. The consequences of the funding freeze go beyond HIV treatment shortages. It has also impacted efforts to combat other diseases including polio, malaria, and tuberculosis. As of March 4th, 167 health facilities in Afghanistan have already closed due to funding shortages, and with over 220 more at risk of shutting down by June if urgent intervention is not provided. Critics argue that this funding freeze is a glaring example of the unintended consequences of isolationist policies. The WHO has called for a more orderly and humane transition to alternative funding sources. Could this crisis have been avoided? Well, some speculate that a more collaborative approach, including both donor and recipient nations, could have mitigated the fallout. Instead, we are left with a ticking time bomb that threatens not just Africa, but global public health. As we watch this tragedy unfold, one can't help but wonder, is this the price to pay for putting America first? Or is it a wake-up call for the world to rethink its approach to global health funding? Either way, the clock is ticking, and the stakes couldn't be higher. Stay tuned for more updates on this developing story. I am Angela Kufuor, and this is the News Guide.